50 years ago, there was a lot of emphasis put on Black people to get into elected office, electoral politics, that was going to be the key. 50 years later, we see that even with Black mayors, Black council people, Black state's attorney, Black comptrollers, and all of that, the condition of Black people in your major cities has not improved, and in some cases, it has gone backwards.
Unfortunately, COVID-19 has shifted trying to get the word out about, hey, this could really hit Baltimore really hard because of the, our respiratory issues here. As an asthmatic myself, and given that Baltimore has so many of them and that COVID is a respiratory virus.
In the early days of COVID, I don't know if you all remember, but there was a rumor that Black folks couldn't get it, right? Mm-hmm. Like, you Black, you can't get it.
Right.
So one of the things that we were really trying to push is, okay, COVID doesn't care what your race, creed, color is. If it's coming for you, it's gonna come for you. How can you stop the spread?
In the early part of COVID-19, and still to this day, prisons and jails were left out of the conversation. It was, when we talked about those most vulnerable on the news, it was talking about people with pre-existing conditions. It was, of course, talking about Black and brown communities. It became known pretty early on, after that myth was broken, that Black and brown communities are impacted most heavily. But even still, when that came out, nobody was talking about prisons and jails yet. Right. And because of that, the top 10 outbreaks globally are in prisons and jails all across the world. And the top 8 of the top 10 outbreaks in the United States are within prisons and jails. And it's because we did not take this, we weren't prepared. We weren't even thinking about it.
So I think it's important for us to create a context about this public health pandemic. The context was, it's no big deal. But when you look at the numbers, it's like, wait a minute, especially once that new data that came out about the fact that Black people were impacted the most by this. So my line of work, it's about, okay, let's cut through all of the chatter and let's get straight to the actual facts. This is like one piece of a larger puzzle. The biggest issue that we're finding when you're dealing with big issues like COVID, police brutality, oftentimes there's no history that's given to connect the dots for people to see that this is a systemic issue and not just an isolated incident.
Correct.
And so I think it's important that if we're going to make the changes that we need to make, the structural changes, you have to present the structural picture. COVID is just one. AIDS was another one. This is something else this adds to the larger health disparities that the Black community is faced with. And I think that for my job, it's like, let's show the larger picture.